Hey, how you doing?
Good. How are you?
Good. Can you hear me clearly?
Yeah. You're
Oh,
coming
yeah,
through
cool.
great on my end.
Good. Yesterday I was having some connection issues. I'm like, how does this work? It's not going because I've never used this platform before.
Yeah.
So it was interesting. But good morning. From Kaiser Permanente, BioscienceLA. My name is Pankaj.
Perfect. Dave Whelan, CEO of BioscienceLA here in Culver City.
Oh, nice.
Hi, Lalima Hawk, internal medicine, Cedars-Sinai.
Oh, nice to meet you.
Wonderful. Look at that. Great.
Yeah, I know.
Got people excited. I like that.
Yeah, right before the holidays too. So what is the BioscienceLA? What do you represent or what kind of organization?
Yeah, so we're and I'll guess we'll explain it. I'll share this in a minute with everyone, but yeah, we're an independent nonprofit, about 3 years old, that was initially seeded by LA County. Cedars is actually one of our founding sponsors, as is City of Hope, Amgen, and we're really here to grow life sciences and health innovation in the region. We've done a lot of work with the KPSOM over the past, since the school was opened, and looking forward to deepening that relationship.
Didn't want to interrupt the conversation. Just wanted to say hello. I've seen some of you all in your face and others online, but thank you all for joining us. This is going to be a great session. I know there's a couple of others that'll be joining you shortly in Dr. Riggs and Dr. Smith, and then you guys will be off and running, but just wanted to make sure everybody was able to connect well. I'm going over to another session, but just wanted to say thank you all in case I don't jump back on before your session concludes.
Great. Thanks, Colin. We appreciate it.
Thank you. And one last final point, not that there'd be any trade secrets, but you guys, the mics are hot. So even though the session hasn't officially started, everyone that's waiting in this session can see and hear you. So just sharing that just in case there's any trade secrets that you don't want to share with the public.
Got it. So they just heard you saying that too, Colin, just so you know, right?
They did. If that's the worst thing they've heard me say today, that's good.
Yeah.
All right, let's see you guys.
Awesome, thanks. Oh, yeah, if you click on people, you can see who's in the room now watching, I think.
Hello, everybody.
Hey, Jeff. How's it going?
Good. Glad you all could join us. Hopefully, Dr. Riggs will be on shortly.
Perfect. Good morning. Thanks.
Yeah, good morning.
I'm sorry, did Colin give us a specific time as when we should start?
I think it was 11:10 was when the session starts.
Great. All right, why don't we go ahead and get started? Thank you to our panelists here. My name is Dr. Jeff Smith, and I'm the Executive Vice President and Chief Operating Officer for Cedars-Sinai. It's my great pleasure to host this esteemed panel of experts here as we talk a little bit about health and wellness. And certainly the whole realm and universe of health and wellness has been affected by COVID. And we're going to talk less specifically about COVID itself and speculating what the next variants might be, but a little bit more about how both health and wellness have changed as a result of the pandemic, and what can we see as we move forward. And so we'll try to cover a little bit about health care, the delivery of health care, and how people might receive that. A little bit about the impact of COVID on people's health and wellness and what that they might do to address that. And of course, we have business members and employers who are part of this forum, are part of the attendees of this event. And so we'll talk a little bit about what we as employers can do to address the health and wellness in the workplace. And so with that, it is my great pleasure to say a brief welcome to each of our panelists. Dr. Lalima Hawk, who is a primary care physician here at Cedars-Sinai, also a prominent physician leader, and we look forward to her comments. We have Dr. Pankaj Lal, who is a family medicine physician with Kaiser Permanente. And then we have Dave Whelan, who's the Chief Executive Officer of BioscienceLA, who can talk to us a little bit about what he's seeing in the industry and particularly around innovation. And so we look forward to that. Now I'm going to ask each one of you to give a little bit more in-depth introduction into who you are and what you do before we move into the questions themselves.
Well, I can get started, Jeff. So I've been a practicing physician for about 21 years and at Cedars for about 15 years. For the last, I would say 8 years, I've done sort of a hybrid role. I have my own panel of patients as a primary care physician in internal medicine, but I also work on the IT side with how we integrate the EMR and how physicians interact with it. And in that role, I sort of act as sort of a liaison to how technology sort of impacts care. And the interesting thing that I got to observe with this pandemic was previously my role was mitigating change, impacting physicians' workflow. So we would have regular upgrades and updates, and physicians were always like, oh no, another change. It's now making my life harder. And how can I take care of patients? And you've moved the cheese yet again. And right at the beginning of the pandemic, I was heavily involved in rapidly moving into a virtual care model that nobody previously had thought was going to be as important as it became. And it was basically the most important thing that we needed to do as everything started to get shut down. Because as we all know, lives don't stop operating and health doesn't stop, needing to be dealt with. And so I worked with our IT department to try to develop ways to train physicians very quickly on how to do care through first telephone and then eventually through video. And so we had to make a lot of rapid fire decisions and understand what the regulations were. And as you all know, the government was rolling out new rules as we were doing this, and there was legal ramifications and out of state, in state. What are you allowed to do? And previously, we were always very hesitant to deliver care virtually because we think we have to put our hands on the patient, but this was kind of a new world order. And so a lot of the work that I've done over the last couple of years with the changes that the pandemic has brought has been initially to technically make this space available and then eventually find a way to, get a steady state so that both patients and physicians are comfortable with the new model. And as we know, crisis tends to expedite change. So I found the unique changes in my personal role is I had less complaints about technology and its impact because suddenly it became the most important thing. And physicians who you never would think would find any comfort in using, video suddenly felt like it was a personal lifesaver because it protected their health as well. So that's kind of in a nutshell what I saw happening. I'm looking forward to hearing what everyone else has to share.
Thank you, Dr. Hawk. I think that all of our health systems had 4 or 5 year plans to implement video visits, which we all just dumped the technology out there in about 2 weeks and asked our people and our patients to figure it out. And so I think there are things that we have learned about how to accelerate care changes. Dr. Lal, please introduce yourself and then just some brief comments as we open here as well.
Okay, well, thank you. Well, first of all, thank you very much for inviting me to this forum, and it's great to be here with you guys. Just a little bit about me. I've been at Kaiser Permanente right out of residency for about 15 years. When I started my journey, I was involved mainly with leadership development for the last 10 years. I also onboarded all the new physicians for about 10 years as well. As physicians would start on at Kaiser Permanente, I would help with facilitating their onboarding. And then finally, I took over a CME program, which really took off and really got us great results, commendation, everything that we do for every single physician at our medical center. So it really, since the beginning, I got involved with leadership. And I think the biggest thing is now I took over for the last year and a half as a PIC at our Culver Marina MOB, medical office building. And it's been a great opportunity. And I took over at the beginning or start of the pandemic. So what a time to take over. And I had a similar experience as Dr. Hawk mentioned, as we were, I think it was April 13th. I'm not sure exactly the date. It sounds familiar, but it was Friday. I remember by Friday, then all of a sudden by Monday, all our clinics face-to-face were canceled, and we transitioned to the virtual care. And it was just like, in a way, at the time, it was the best thing that could have happened. And it really, for us as at Kaiser Permanente, we were having telephone visits, but there were 1 or 2 per session in the morning or afternoon. And we shifted to 100% virtual for the next 4 months until September. And in September, then we shifted back to seeing face-to-face again. But it was just a necessary change. Unlike Dr. Hawk, I wasn't involved with the actual onboarding, and I'm glad I wasn't because, wow, but they did a great job. How quickly, luckily we already had Kaiser phones, iPhones that were issued to us to help with that technology. So it really helped our members to keep in touch right then and there. It was a smooth transition for the day after. At the Monday that came, where everyone just shifted, it was just a smooth transition, but there were kinks that had to be worked out. So through that transition, we definitely provided great care telephonically, and something that I guess we are going to get into, how do we catch up on the care that was diverted? A lot of members did get that care, but at the same time, we're still playing catch up, and we still have that increased demand. But I won't say that much more so we could get on, but yeah, we had a similar experience as Dr. Hawk mentioned as well.
Yes, we'll certainly be talking about the impact of delayed care shortly. Thank you for introducing yourself. Dave, tell us a little bit about yourself and what you do.
Perfect. So thank you. Excited to be here. Dave Whelan, CEO of BioscienceLA. We're an independent nonprofit organization about 3 years old that was initially funded by LA County. We have backers like Cedars-Sinai and City of Hope and Amgen. We've been a virtual organization until recently, but we we're part of a county effort to completely remodel the former LA County courthouse in Culver City on Overland, and so we've built this collaboration hub here. And I'll get into what we do in a second, but again, the organization is about 3 years old. I came on as the first permanent CEO, with my first day as CEO being Monday, March 16th, 2020. So, kind of a fun day to start a new role, especially where our organization is all about driving innovation in healthcare. And what a perfect kind of test case for innovation. And so, while I thought my role was initially going to be about kind of call it deep innovation, connecting the academic institutions and funders, it became very quickly just how do we help connect people who are on the ground and can make a difference. And so I was having conversations with people who were developing new ventilator technologies and developing new test technologies. I was ended up on the LA County Economic Resiliency Task Force in the healthcare group, which was focused on we were focused on reopening, and we had a whole process of talking about reopening during June and July of 2020. And then I think at the end of that, we realized that we probably should not be talking about reopening just yet, because we weren't quite there. But it's been really interesting to help bring together healthcare organizations, some of the innovators, and really focus on how do we start to make a difference. And interestingly, between work that's gone on at actually both Cedars and City of Hope around some innovations with vaccines, we had some amazing test technologies here, including a company called Curative, which didn't even really exist in February of 2020, was kind of a nascent company in the Bay Area, and through some just kind of coincidental connections, they ended up moving to San Dimas practically overnight in March 2020, and standing up what is now one of the largest kind of independent COVID testing operations, not just in California, but in the country, I think.
Yeah, just amazing how a crisis can produce both challenges as well as incredible opportunities for those who are in tune and entrepreneurial and look for opportunity to take advantage of some of those things. Well, Dr. Lal, you had hinted at a little bit about one of our topics is that, we have seen, and there's good studies across the country that have shown that screening for cancer, for example, whether it be screening for colon cancer or breast cancer, cervical cancer, has gone down dramatically during the pandemic as people have avoided care. I think in addition to that, childhood immunizations are falling behind. And then even furthermore, we have people with chronic diseases like diabetes or heart disease who have not been tending to their chronic disease. And we're seeing patients present to the hospital much sicker. What do you think we can do to help address that backlog of care and encourage to keep people to get caught up and come back again?
Yeah, thank you, Jeff. Great question, and it's just something that I can definitely tell you that we've been, brainstorming and working with our physicians and leaders to make sure that we address this. And we did recognize in the first 4 months when we were on the pandemic, we were just on, hey, life support. We need to just make sure our members get the care they need. And so we did everything telephonically. But in that time, no one was coming in the medical center for mammograms, colonoscopy. We shut down our surgical operations and everything. So that backlog built up. By September, when we opened up face-to-face, we were at 70% virtual and 30% face-to-face. So that brought some of our members in. And so we were screening the ones that were coming in, but still the ones that we're connecting with virtually, we would talk to them about their studies that were due, but we knew that there was a lag. And then the second wave hit in December. And so once again, we shut down a little bit more and then opened up. And by beginning of January this year, we shifted up to 70% face-to-face and about 30% virtual. And that's something important because we saw the demand that our members are saying, hey, they put off their care until the second surgery is over. And now all of a sudden there was this huge demand of like, hey, we want to come in to get our care. And the hard part is there's only a certain amount of slots that you have for face-to-face. So what we have done at Kaiser Permanente, luckily, when we started our vaccines, it was a great opportunity for us to get the information out that we want our members to come in to get the vaccines. So what we did was, as they came in for the vaccine, we looked at their care gaps. Any cancer screen that was due, we would actually look at them and start booking it. So they were showing up for a vaccine. They didn't even know they were due for a blood pressure check. A blood pressure was done right there. And that was a coordination with our leaders. Their blood pressure was done to make sure that either they were taking the medications or their blood pressure was addressed. We also took care of mammograms, colon cancer screenings. We did shift to the booking our mammograms, and as well as our IFOBT kits. We started giving those out even more frequently. So really, it was something that we knew that the demand was coming, and it's like, hey, how can we do this? And we actually, assimilated that care gap, like, hey, what we had to close with their vaccine. So that really, really helped us out. The other thing that we did also was outreach. So all of our physicians can get outreach lists, and we could look at the ones that are due for mammograms, colon cancer screening. So that was for the preventive care. So that was pretty easy to give to our nurses to get involved, calling our members and just telling them, hey, why don't you come in and actually booking for their visits. About chronic disease, I did mention that a little bit, that when our members came in for their vaccine, we did address that by checking their blood pressure. But also if they were due for labs at that time, we'd go ahead and order the labs right then and there so they'd have a seamless transition from getting their vaccine to getting all their care done. Having said that, I'll tell you this much, for the average frontline physician, it's been a monumental task. And I'm telling you, everyone has stepped up to the plate. They're doing extra clinics, hours, and everything to try to give this great care to our members. And it's just something that, we always say our true north is, the best patient care that we can give, and having people come in for their care. But I'll tell you this much, that does come at an expense, because a lot of physicians are feeling that, hey, we're trying to get our members giving the best care. So we're working on our systems by incorporating soon, like artificial intelligence, that's going to be helping us. We have KP Now, that's actually a 24-hour service that were actually implemented, started about a month ago. That's going to help our members come in and get their needed care to help them close their care gaps, but address their acute care conditions as well. So it's something that we're looking forward to, like during this all the time of innovating to close those care gaps that for prevention and also helping with chronic disease management at the same time.
Thank you, Dr. Lal. We'll certainly be talking about kind of the health and wellness and burnout of the healthcare workforce, as well as other employees in other industries in just a minute here. And thank you for sharing some of the innovative things that Kaiser Permanente is doing to help improve the health of our community for some of those patients who have had deferred care. I'd also like to welcome to our panel Dr. Richard Riggs, who is the Chief Medical Officer here at Cedars-Sinai. Rick, if you could just take a minute to introduce yourself, and then I'd like to come back to this issue about virtual care. So, we've heard both from Dr. Hawk and Dr. Lal that, there were times where we were doing 100% virtual care on the outpatient setting. I think both places saw us then go to about 40% virtual and 60% inpatient, in person. And then now it's probably dropped even a little bit from that. So, Rick, if you could introduce yourself, tell us what you do, and then what you see as some of the frontier for virtual care.
Hi, Jeff. Thanks. Thanks for inviting me to be here, and happy to be here. Yes, I'm the Chief Medical Officer. I'm a physical medicine and rehabilitation physician by training. Also did a tour of duty as Chief Medical Information Officer here at Cedars-Sinai. I luckily was not in that seat when the virtual care swing pendulum happened, but I had just taken this role actually, so I'm not quite sure. So same with you, Dr. Lal, about 2 years I've been in this role. So what I would say with the virtual care is, we certainly had to pivot to take care of our ambulatory patients, but given the sort of lack of knowledge around COVID on the inpatient side, as well as precautions, as well as the visitation restrictions, we actually spun up bedside, consults on the inpatient side also. Whereas folks that didn't need to enter the room could actually visit with the patient and do their evaluation and assessments or review the care plan with the patient with regards to that without having to physically come in and out of the room. Of course, early in the pandemic, we had the supply chain concerns also. Additionally, we also were able to spin that up for visitation. Again, those human connection of being very isolated in the COVID timeframe of folks being very sick. And this was a great comfort to many people who were involved in that. And again, it's not perfect. And yet, I think as Dr. Hawk had, sort of stated, something is better than nothing. Suddenly the technology, people were grateful that they had something to connect, right? It wasn't just about it being like being in person, but it was about something. Again, I think there's, multiple papers that are being published on what effective, telemedicine type, and video conferencing has done during the pandemic. And actually some of the healthcare equity gaps have actually seen places increase in their use of this type of visits, because the time off from work, the time to get there, the sort of abilities actually were barriers to folks that in some socioeconomic or with a social determinant of health needs. And so I think it's been a sort of half empty, glass half empty, half full type piece. I think we're continuing to learn, and we'll understand some of the best ways to do this, including like how do we train our physicians, to be ready for this type of medicine in the future, and what is actually good care. And to Dr. Lal's point, when they come in, when they do make an in-person visit, do everything you can, right? So make it worth their while. And I know there's been models of that throughout the country over time, but I think we can all learn from those examples.
Thank you, Dr. Riggs. I would say, Dr. Lal, those of us here at Cedars-Sinai are a little bit jealous of Kaiser Permanente because of your model as being the insurer as well as the healthcare provider. Some of the barriers about how you get paid and are taken care of. And you guys, I think, were even more advanced in some of the video visits and moving in that direction faster than many. So, congratulations on that, on being pioneers. I think we have some things to learn from you in that aspect.
Yeah, no, thank you. I appreciate that. I appreciate you saying that. And yeah, as a consumer of actually the video technology, we had some, believe it or not, I was using Doximity to begin with. So Doximity was something that we were using, a lot of physicians were using until we got our technology in place because of the rapid change. And yes, I agree with you, Jeff. That's one thing I didn't have to worry about as a physician. So that actually made it easier to just focus on the member. And so, yeah.
Congratulations. So Dave, you're in a little bit different role. We talked about virtual visits as kind of one aspect where technology has been applied. I'm interested to hear about other innovations in healthcare that you're seeing.
Yeah, no, thank you. And as I usually do, introduce myself in talks like this. I've been in kind of the intersection of technology, health, and wellness for 20 years. I'm neither a physician nor a scientist, but I've found ways to kind of help all of them talk to each other, along with talking to the investors and the attorneys and the software engineers who can all make it happen. So that's sort of how I get into this, and it actually has been very exciting. I mean, what we talked about with virtual visits, telehealth, I think that's something I've watched evolve over many years and sort of be just on the cusp. And it's sad that it took a situation like this to really push it over, but I feel like now that the genie is out of the bottle, hopefully that does remain. I think in terms of some of the other technologies here, what we have in LA is a tremendous amount of intersection of technologies. From I'll mention Cedars one more time, because the kind of AR, VR being used for digital therapeutics at Cedars, I think, is such a tremendous development that's going on here, which has an impact to, certainly support just some of the mental health issues that could be coming out of COVID, but also, tackling opioid epidemic and things like that, becoming a really different way to approach care. Los Angeles is arguably one of the innovation centers for cell and gene therapy. So, CAR T and, companies like Kite, which is not that far from us here in Culver City, and now Gilead. But, we've seen some tremendous advances in that over the past several years, from a funding standpoint, from an innovation standpoint. And then layered on top of that, we've got, I think, a pretty amazing digital health and sort of health technology culture here in LA. And so there's large companies like a Headspace or things like that, which 5 years ago you might not have called a healthcare company, but they've certainly evolved more and more into that. And with some of their recent mergers and acquisitions, I think they very much are a healthcare company with a regulated business on top of their basic consumer app. Companies like GoodRx here, which is focused on really on the delivery of healthcare from one angle, which is how do you pay for it, what does it cost, things like that. And so I think we're seeing all these innovations coming together, and sort of the stressing the system that comes from something like like COVID has really helped some of these technologies come to the forefront. Some of them get adopted more quickly, and but also, as a couple of us have said, opens up some of these issues around certainly income disparities, access to technology disparities, which certainly cuts across socioeconomic levels, things like that. But even many of us probably dealt with friends, relatives who couldn't even figure out how to sign on to get a vaccination appointment earlier this year, right? And in particular the senior population that was that first group to have access to those, and most of them couldn't figure out how to actually reserve something, and so there's a lot of opportunities to kind of improve, and I think LA can make that happen.
Yep. Yeah, thank you so much. Lots packed in there. I would say, and thank you for mentioning healthcare disparities or healthcare equity. I think that's important. One of the interesting things that we recently found here at Cedars is that it actually, some of the people who have lower socioeconomic status or actually had the highest uptake of the virtual visits. Seems like everybody's got a cell phone, or most people have a cell phone, even if they face some other economic or other challenges. But the fact that they didn't have to take off work, that they didn't have to find a bus or transportation to get care. I think that we need to continue to look at how we address healthcare disparities through technology, and that there will be opportunity there. I'm going to switch topics now, but before I do that, I'd like to encourage any of the people who are listening in to start entering some questions into the chat. And if we have time at the end, we'll look forward to our posing some of those questions to our expert panelists. I'd like to talk a little bit about health and wellness in the workplace. I think we heard Dr. Lal mention that really there is an epidemic of burnout amongst physicians and other healthcare workers, not just physicians, but healthcare staff as well. This was something that we were paying attention to, and certainly a trend that we were noticing prior to the pandemic. And I think the pandemic has certainly accelerated that. People who are in many cases overworked, who were initially fearful that they were putting themselves at some personal risk in caring for patients. And then on top of what everybody else is experiencing with some degree of social isolation and potentially financial stress and other stressors. And so, certainly we play a role as employers, and this isn't unique to healthcare, I would say. Also, we're seeing in business the so-called great resignation. People are dropping out of the workforce, and it's hard to fill positions, which is another challenge that we're facing, particularly here in LA. Is difficult to find people to fill positions, and wage escalation as a result. One of the things, so I've identified a couple of factors which I think that might contribute. Why don't we start with Dr. Riggs? What are some of the things that we are doing or can be doing to address the issues of wellness in the workplace?
Thanks, Jeff. So I think that one of the things that I've been sort of relating to folks is the capacity of us of everyone as individuals. Every society, every person has been personally altered their lifestyle based upon this pandemic in some way, shape, or form. And anyone that is in any kind of business has also dealt with this. And it's in the background, and it does take for anyone, it takes a certain resilience to actually sort of be able to find joy in spaces where they haven't had to before. We had essentially a shutdown of sports for X number of months, right? And there's so many people both participating and watching that this sort of like sudden sort of void, right? So everyone's had to understand how they fill that. In the workplace, I think the most important pieces for us has been the connection, the caring, the making people feel heard. They wanted to be safe, well, and informed. And so keeping the forefront. We've had today. We sent out our 400th COVID-19 update. 400. All right. And so there are communications in each of those for our workforce about what we were doing for them, how we were caring for them, and each one of them contained a message around wellness and caring. So the connectivity, really is really, really important, especially when our physical distancing and isolation pieces have made things and gatherings much more difficult. So anywhere that we can create cohesiveness, as well as giving the staff involvement in self governance with panels or with sort of sessions and meetings around what they would see as ways that we can improve the workforce. And I think every business is going to be challenged with that, creating a connection and a stickiness to the workplace that goes beyond any type of pay or actually duties, but a sense of belonging.
Thank you. So, Dr. Lal, you're, in addition to being a leader, you're a frontline physician and caring for patients. And we know that group has been particularly stressed. And once again, surveys have shown that more than 40% of physicians meet the clinical definition of being burnt out, and many considering even leaving the profession. I'd like to hear a little bit about, maybe not to be too personal, how you're doing, but what you and your colleagues are dealing with at the front line. Some of those sources of frustration and stress for you, and maybe some things that you're doing to help alleviate or counteract some of that, both personally as well as with your colleagues as a physician leader.
Yeah, no, thank you, Jeff. And I could just tell you that, a pandemic really, I mean, for me in the beginning, the transition was great to virtual care for first 4 months for virtual and everything. But I'll tell you this much: when we look back right now, for a year and a half, I could definitely tell you, me personally, I am feeling the stress, and it's just the amount of volume, the amount of things that you have to catch up on, the studies, the preventive care you have to give. Majority of physicians, we look at, they keep track of how much we do work out of the office that's uncompensated, which we're not talking about. We don't want to be compensated, but how much they just keep track of those hours. Majority of primary care physicians are doing their work from home for about an hour and a half a night. And so that's what people don't understand, that really has affected our life, whether that's digital, because not only are you seeing your face-to-face patients now, but you also have all this other, studies and everything that are coming back at a rapid pace. We could get our labs ordered today; they'll be back by tomorrow. And so the way we practice medicine versus paper charts it was before was like, oh yeah, you order labs, 4 days later you'll get the labs. Now it's at such a rapid pace, and I can tell you, it did challenge my wellness as I got back into it and seeing more face-to-face and then virtual. And I guess for me personally, what keeps me grounded is this family. We actually had a lot of grand rounds that we have for all our physicians at our West LA offices and our medical center. And a majority of our grand rounds are focused on wellness. And so that has been great from our medical director, Dr. Kirk Tamadon. He's made it a point that, hey, you know what? It's okay. We've even had talks about different support services that we can give our physicians. And we encourage them to actually go out and get counseling. And so, and you know what? There's one question on, interviews and everything. Have you ever gone to a behavioral health specialist or anything? You know what? Now we're actually saying, hey, guess what? It doesn't matter. We might even take that out of the interview process or whatever it was, something around that, because we're finding out that mental health is becoming, top priority. And unless we address that with not only in our members that we see, our patients that are coming in, and help them take care of their health and mental wellness, we realize that our workforce 100% is feeling the same thing. And unless we address that, it's going to be 2-3 years from now. We're already facing a shortage in primary care of physicians that are coming out. Now you're facing that with a resignation of physicians. I even have one physician who's going to be retiring next year, just taking early retirement just because the stress is, catching up. And so what we do just locally, we have a lot of activities about wellness. I myself round on the whole MOB, just talk to people. How are you doing? Rounding is something that I found to be so valuable. I'll stop by nurses, doctors, everything, just say, hey, just check in with them. And we actually have that culture of like, hey, are you okay? One day I walked in and my head was just down, and the receptionist just said, are you okay, Dr. Lal? I'm like, oh, thank you for asking. I mean, just that little bit, a couple of words just means so much. So just really being intentional about it and understanding and showing people as a leader that you care helps. And then just having a lot of support services around that, encouraging people that, hey, speak up and don't hold anything in, will help resilience. And I'll just add one last thing. One thing that we actually brought up at our meeting yesterday is that how we can work together interdepartmentally. A lot of our chiefs, we had a big chiefs meeting, each OBGYN, surgeons, each person came in and chimed in about what they're going through and the stresses that they're feeling. And it was something that, because I was in leadership development for about 10 years before I left last year, I said, what we need to do is how we can work interdepartmentally. And we haven't leveraged that completely yet. And it was something that was very, very well received yesterday. And I think for the next year, if we get to figure out how our departments work together, it's going to really help us because we're not doing extra work. We're doing the work that needs to be done. It's going to help indirectly in the long run. And balancing that with, hey, we're supporting our physicians by getting artificial technology or getting other resources, I think it's going to really help offload that stress that the physicians are feeling.
Yep.
So.
Yes, thank you. So a number of pearls there. At Cedars-Sinai, we are also offering all of our staff and all of our physicians access to mental health services, as well as financial advisors, people who can help find care for elderly parents or child care. All of those things have become very important, and have actually had mental health professionals rounding in the hospital on our caregivers. And we found that to be impactful as well. I think Dr. Riggs also mentioned that importance of connection, and we're gathering small groups of people to have to just gather for lunch, which we used to, it used to be regular. Now we have to be diligent about that, schedule that, and build those personal connections again, which make us human in this work fulfilling. Dr. Hawk, so once again, you see patients who are experiencing stress and burnout. Can we talk a little bit about patient wellness? I saw a recent statistic that 42% of patients have gained weight over the pandemic, with the average being 29 pounds. I think the other 58% are lying or just haven't been on a scale. Certainly we have seen that alcohol consumption also has gone up significantly during the pandemic. 32% of people are admitting to an increase in alcohol consumption. What are you recommending to your patients about maintaining both their physical and mental wellness during these challenging times?
Well, that's a very interesting point, Jeff, because just recently I had a patient come in and the nurse came into my office and said, well, we have an alarm that the patient has a 30-pound change in weight because the system is designed to show significant changes in your vitals. And, the nurse was very, worried that what do we do? And she hasn't been trying to lose weight. This was a weight loss. And so after I went in and had the conversation with the patient, she was basically acknowledging, hey, it was the pandemic and I was eating whole bottles of Nutella in a sitting. And I wasn't even caring because, there's, like you mentioned, the social isolation. There isn't any like sporting activities, entertainment was shut down. You couldn't even go out for a walk without feeling worried that you might get infected. And so people just resorted to what was in their homes. And she said, once things started opening up and I went back to school, the weight came off naturally because I was just not following that really excessive diet. And so for me personally, what I've seen is two extremes. Either people go on one extreme and exercise very, very aggressively because they're stressed and they've had significant improvements, but maybe even to the point of injury. And then on the other end of the spectrum, it's the more sedentary, I have no excuse to do anything, I'm not motivated. And as a physician, what distressed me was how much it highlighted the lack of mental health resources that are adequately available. I have patients who are mental health providers who were burned out and, very much unable to take the volume of patients that were seeking mental health services. And, you know, as a primary care physician, obviously, I try to manage the spectrum of their health, you know, from physical to mental. And I always reach this sort of, you know, conclusion about how my hands are tied when it comes to mental health, because unlike sending you to see a cardiologist or a dermatologist, I can't just pick up the phone and schedule you an appointment for mental health, because so much of it is carved out and it's not easy, is not readily accessible. And I feel like it should be sort of nationally, locally, wherever, it should be a call to arms to how we can develop mental health and give it the importance that it is due. Because if nothing else, just like you've seen with the uptake of benzos and opiates and all kinds of even like domestic abuse, things like that, that have increased as a result of people being in place. I mean, we can't forget what people's lives are like when they don't have the sort of release of going to a workplace or someplace else to sort of mitigate the impact of what they're dealing with in their personal lives. They've had to go into their own lives more in depth. And we really need to sort of start looking at this as a great opportunity beyond the pandemic to sort of develop these sorts of resources, because this was truly highlighted by this pandemic.
Yes, thank you so much for pointing out that criticality of mental health. And we could probably do a whole nother session on the impact on kids and studies that have come out showing the impact on their mental health. And certainly kids who are have challenges at home and aren't getting to school, having difficulty getting to school or access to learning and access to other social supports, I think is another area to highlight. So Dave, you know, you talked earlier a little bit about Headspace and maybe some how we might leverage technology in this wellness space. Do you have thoughts or observations about that?
Yeah, and I think just, you know, following on what we were just talking about, I think you know, again, clearly all of us are, you know, all of us are in a lower mental state of you know, one level or another than we were a couple of years ago. I think that, you know, clearly that's impacting the, you know, the healthcare practitioners. It's, you know, it's impacting everyone. And what I think is really interesting and a challenge and opportunity is that, you know, we are seeing a lot of large tech companies, and, you know, in the Amgen here among them, you know, that are not necessarily going back to work in the office, you know, at least 40 hours a week in many cases. And so what used to be the conversations that colleagues would have or a boss and their team would have, it's not happening in the same way. And you know, on Zoom, it's really hard to tell what kind of day someone's having. Although I guess you can also see their kids and their pets, you know, jumping on them more than they would at the office, so you have a sense. But, you know, it's very hard to tell. And so I think we will be able to leverage technology and, you know, some of the you know, the AI tools being developed in LA, you know, one, to understand what's going on with people and be able to make some recommendations, you know, not diagnoses, but recommendations, in the same way the Apple Watch will, you know, it's not going to tell you that you're having a heart attack, but it will suggest that there might be some abnormalities, you know, irregularities, and maybe you should talk to someone. I think we'll see a lot more of that with tech, and whether it's via our phones, via text messages, via you know, video things, in a way where we have this better sense of you know, mental state of people and how we can react. And then you know, what that also opens up the opportunity for is, we have seen, we talked about telemedicine a little bit earlier. We have seen this growth of at-home testing as well, and access to data. And so I'm kind of excited for an opportunity, especially in a place like LA, where sometimes getting to a doctor's appointment for those of us who, with cars, it can take a long time. For those of us who are using public transportation, it could take more time than people have, or more time than people can afford to have. The ability to get an at-home test, you know, have it go right to your phone, or send the test kit back, get results, meet with your doctor virtually, and do all of that in a way where we'll be able to really transform care in a way that is going to raise the bar for everyone. And again, I think LA is a place to make that happen, because we've got the technology, we have the need because of the sprawl, we have the need because of the some of the disparities, but we also have this responsibility to figure out, if we're not just developing technologies for those who can afford it or those who have the latest iPhone or who have broadband, we have to develop it for people who don't have all of that.
Yep. So yes, thank you once again. And we also have great health systems, right? Great health systems who are learning to work together in different ways to improve the health of our communities. Well, we're at the end of our time here. I wanted to say a special thank you to all of our panelists and all of you of what you do every day to care for your patients, to care for your community, and to care for your colleagues. I think that's really important. It really has been a pleasure hosting this session. Thank you to those who were listening and watching in. Have a great day and enjoy the rest of the conference.
Thank you.
Thank you.